Hello, my name is Lance French, and I'm a student nurse. This is my return demonstration for an intramuscular deltoid injection. So to begin, I will need to gather my materials, being a pair of clean gloves, at least 2 alcohol pads, a 3 cc syringe with a 5/8 long needle that is 25 gauge, and the medication vial. Firstly, I'll need an order from a prescriber as well as a medication administration record, so the MAR. So firstly, now that I have those things, an order from a prescriber and the MAR, I'm going to inspect the vial for any defects, inspect its expiration date, look for any particles, particulates inside of that, as well as any cracks. If it were a multi-dose vial, which it's not, I would initial it, time and date it onto the label so that anybody further could see and discard that when it's appropriate. So now I'm going to select the appropriate syringe, being a 25 gauge syringe capable of 3 milliliters and a 5/8 inch long needle. So I'm going to need to open up that and grasping it on the outside, making sure that lower lock is on, and dislodging its cap. I'm going to draw in 3 milliliters of air into that syringe to displace the medication that I'm going to draw from the vial. And I'm going to clean the top of that vial, the rubber top, with a new alcohol pad. And allow that to dry before I pierce that with the needle. So now I'm going to inject that and horizontally draw up the 3 milliliters of medication as per the provider's prescription. So there we go. And we're getting quite a bit of air, and I don't know why. Okay. Okay. Now I'm going to use the scoop cap method until I'm ready to inject this, so I have some things to do. So now that I know that I have the correct amount of medication in the vial, the 3 milliliters, I'm going to knock on the patient's door and introduce myself. My name is Lance French. I'm the student nurse. I'm going to perform hand hygiene. I'm going to identify the patient by 2 methods, explaining the procedure and what this medication is. So now I'm going to explain to you how to find the correct place to perform an injection, intramuscular injection on a deltoid site. You would go on either side of the patient and feel the bone on the upper outer aspect of their shoulder, which is called the acromion process. And when you find that, you would go 3 fingers down, in my case, due to the size of my hands, and you will inject into an imaginary triangle in that imaginary boundary. So firstly, now that we have that, we're going to don these clean gloves. We're going to clean the injection site. So I'm going to take an alcohol pad And I'm going to apply in that imaginary triangle. I'm going to go from the inside out, cleaning that with an alcohol pad, and I'm about ready to perform the injection now. So I'm going to expose this needle, and I'm going to, on the patient's imaginary right shoulder, I'm going to take my left hand, placing it at their chroming process, and seeing that imaginary triangle, I'm going to now pierce the person's skin to perform the intramuscular injection. So I'm at a 90-degree angle, quickly and smoothly. Secure it against the patient's body. I didn't see any blood aspirate back up into the needle, so I'm going to perform this and move forward. So now, since I have my approved sharps container right next to me, I'm going to, in one motion, I'm going to go straight into the sharps container. Okay, now I'm going to get a gauze pad. I'm going to cover that injection point so that I catch any blood. Well, this patient stopped bleeding, so I'm not going to choose to use a Band-Aid. If they continued to bleed, I would use a Band-Aid, but in this patient's case, I'm not going to. So now, I'm going to remove my gloves, perform hand hygiene, document which injection site, which side, what I did, and the 6 rights of medication administration have all been checked. Right patient, right dose, right time, right route, right drug. And I will now complete everything in the MAR, and that would conclude this task.